The previous article looked at the primary purpose of the home screen in an electronic medical record, and we came to the conclusion that its main role is to actually be bypassed in order to get to the patient file as quickly as possible. The home screen really serves the function of displaying and serving to the clinician the next file they need to access. And there are at least 6 different ways that this search strategy can be accomplished. And this article will go through those. One of the first questions you need to ask yourself when you're trying to set up this infrastructure is, will the patient sometimes be in front of the clinician searching for their file and sometimes not? Will the patient likely not be physically present when the search is occurring? Or will the patient always be physically present when the search is occurring? Because this will determine the type of search options you have available. So let's start with the very first one, that the patient may or may not be physically present at the time of the lookup. In this case, you have a few different options. The first is to scan a barcode or a QR code for that patient. And this is easily the quickest way to probably pull the right patient file in almost any circumstance. It's a very good lookup strategy because the patient doesn't need to be physically present. If you have, for instance, paperwork or blood work with their barcode or their QR code on that sheet of paper, you can access it in the electronic record, or if the patient walks in with a card in front of them, you can also pull up their file that way. And so its advantage is that it produces a fast, reliable, one-to-one match without any typing. And of course, the disadvantage is you do need both a barcode or a QR code, both on the patient's ID as well as on their paperwork, and you need some device which you can scan this in, either using the built-in camera on a mobile or a tablet, or an inexpensive USB or Bluetooth barcode reader. Another potential disadvantage is that if you're continuously activating a phone's camera to scan the patient's ID, in theory this may decrease the device's battery life, but I'm actually not sure of the real-life impact on this. The second search strategy is to manually search for the patient by number. And if I had to suggest that there was one search strategy to start with, by default, when building an EHR, this would be the one I would go with. It's incredibly robust. It works across many scenarios, many devices, many care organizations. It produces a reliable one-to-one result. If you type in the right 8 or 9-digit number, you're probably only going to return one patient with that number. And it has the built-in advantage that your way which you can check that that number was correct is it's going to return a patient name with it. And if that patient name matches the patient's name, it's likely the correct match that you've gone through. There are, of course, exceptions to this. For instance, if you have multiple 9-digit numbers which have the same arrangement, you might end up pulling up 2 patients. For instance, one patient which is from a national number which is 9 digits, and one patient which is from a hospital number which is 9 digits. So ideally, that you don't have numbers which are of the same length in your organization, or you have some way to validate or check this. But in general, very robust, very reliable. Really, the only disadvantage is that if a patient may not have a unique identifying number, you would have to employ some alternative search strategy. Of course, there's lots of other advantages of this, that you can default your application to automatically pull up a number pad when you enter the number on a phone or a tablet. And this is also faster than using, let's say, a keypad with alpha characters in it. The third strategy is to search for the patient by name. And I really do not like this strategy at all. It's very tricky because patients may have multiple first names or multiple middle names, or they might go by nicknames, or the person who's entering the information may not know how to spell the name which they're being told by the patient. If you're also typing this in on a tablet or a device or a phone, the keyboard itself is much smaller than the number pad when you're looking at on these types of devices. You also need to probably add into your system some sort of a name matching or a master patient list service in order to find similar sounding names, name variants, misspellings of names. And there's a very high chance that the search result will yield multiple patients with the same name. And so the user not only has to take longer to enter the name in, but they have to be very careful to ensure that because they have multiple patients with the same name, that they're actually selecting the correct match using other information such as other patient names or relatives or contact information, date of birth, clinical issues, or last appointment visit. And so this approach of searching by name isn't ideal. It doesn't always produce a one-to-one match. And unlike searching by number, after you search by name, you have to employ a more creative double check strategy to ensure that you've actually pulled up the correct patient file. As I said, you have to double check that there's date of birth and there's address and several other multiple key factors, because it's not uncommon to have the same person with the same name and even the same address or even the same date of birth potentially within a catchment area. I also think that the search strategy, in addition to being more risky, is also more slow than alternatives. And so this is really why this is my least preferred method. I would say this would be a backup method if alternative methods don't work. And if the patient name search doesn't work, you could use alternative search fields such as contact information, date of birth, towns, relatives, or other ways which you could search for someone, perhaps their email address. Just one other point on the options on numbers which you could use to search for a patient. Don't forget that you could search using a phone number potentially as a numerical way to identify a patient. We move on now to the fourth option on ways to select a patient, and that is the patient queue within an active clinic. And selecting patients from a patient queue is an excellent method for clinicians working within an active clinic. But it's important to realize that this probably isn't the best search strategy for patients arriving at the front desk. So let me explain. If a clinic has 40 to 60 patients, let's say, for the day or for the half day, and that's not a crazy number for a lot of clinics in a lot of environments, it's likely faster, I think, and I haven't run the trial, but it's likely faster to just enter a patient's 6-digit or 9-digit numerical code into the system than to scroll through a list of 50 patients by name, trying to make sure that you've sorted the list properly, either by first name or last name, and that the name the patient gives you matches. And then after you skim through this list of 40 to 60 patients, if you're working at the front desk, you then need to double check that the patient file that you're looking at is actually the correct name, because it wouldn't be uncommon to have two patients with the same name coming to the same clinic. And so this whole process of skimming through a long list of many names on a small device, trying to look through, let's say, 60 different people in a list, trying to pull out that particular person, trying to validate that that's the correct file, to me, this is all far more cumbersome than simply entering a 6 or an 8 or a 9-digit number, and then after that returns one result, verifying that that one single result is the correct patient by name, for instance. And so I do not think that the patient queue should be used at the check-in, for instance, to a large, busy clinic. But once you've been checked into a clinic, it's probably a very good method to alert clinicians elsewhere in the clinic on who the next patient they should see is. This falls into our purpose that we discussed of the home screen in the electronic health record, which is to alert the clinician who they should see next. And so a patient queue within a clinic is a very natural way to alert the clinician who's up next for their care. Let's move on to section B now, or the second option, where the patient is likely not present at the time of the lookup. And so in this case, this is kind of where the concept of patient lists come in. And a patient list, I think, is exceptionally useful in many situations. And a patient list, I'll just differentiate it from a patient queue. To me, a patient queue is a patient list which is specific to an active care clinic or a care setting. It has a clear hierarchy, for instance, within a patient queue of people who are being seen, who are not seen, who are late to be seen. A patient queue might have multiple providers who need to see people within that queue and within that workflow, whereas a patient list is much more of the broader category of ways which you can generate a list of patients, and the patient queue is a subspecial a subset of that patient list concept. And so the patient list to me is not in an active clinic, but it's usually in places where you actually aren't physically seeing the patient right in front of you. For instance, you might have a patient list of blood work results to follow up on, or you might have a patient list of patients to contact who missed yesterday's appointment, or you may have a patient list of newly referred patients, or a patient list of patients on a physical ward. So you get the idea that often you'll be accessing this list in circumstances where the patient isn't physically in front of you. And so this is obviously a very effective mechanism for the clinician, because if the list automatically generates itself, then it's able to become a powerful workflow. And it can help direct the clinician to know who they should follow up on, what they should see next, and kind of similar to a to-do list or an email inbox, that list can be worked through, checking off the patients as they're successfully followed up upon. And so it has lots of advantages. It's intuitive to use, but the disadvantage is that you really need to make sure that the search parameters are reliable in generating the list, or else the clinician won't be able to rely on that list for their workflows, and then it really loses its utility. The very last option is that you are looking up a patient and they are always physically in front of you. And in this case, you could consider something such as searching for them by a biometric. And some people really like biometrics. They consider them the gold standard, and of course, in many ways they are. But we have to realize that a biometric, such as a fingerprint scanner or an iris scanner, often is much more troublesome than it may first appear. For instance, the moment you begin to introduce additional physical hardware for the biometrics, such as the fingerprint reader or the iris scanner, you end up having additional costs. You have the chance for hardware malfunction. And if you have a large organization with many devices, such as mobile phones and tablets and desktops, spanning across many clinicians, across many locations, this just adds increased complexity to a system. There's also the chance that biometrics always have a false negative rate, in particular for fingerprint scanners. And especially if the device is being operated by someone who doesn't really know how to use it. And so there's always the chance that the biometric may not work. And so there is, I think, the potential for biometrics to be really effective, especially when we get to the point where you're able to use your on-device camera to identify a patient without the need for additional hardware. But until that point happens, I think that the use of a biometric can be a supplementary search strategy, but really not the primary search strategy, or at least one without a redundant option as discussed from the options above. It's also important to realize that this article has been discussing search from the point of trying to pull up the correct patient file. In a separate article, we'll discuss the fact that this is very different from identifying a patient's identity, ensuring that the person who says that they are, who presents a card, actually is who they claim to be. And so patient identity verification strategies is a different concept than patient search strategies, although there is some intersection of the two. And maybe just one thing to end, there may be some criticism that I am overtly paranoid about searching for patients by name as opposed to by number. And this kind of aversion to this search strategy comes from my time on medicine units, where you might have a unit of 20 to 30 patients, but it was quite common to almost always have at least one patient, or sometimes up to 3 patients on this small unit, who have the identical first name and identical last name. Even sometimes we had cases where they had the same date of birth. And so this is why having a default search strategy where you use a search method other than their names is really preferred for me. And especially if you're working in an environment where you have a community health worker with several hundred patients, or a catchment area of a clinic with several thousand patients, the chance of pulling up duplicate records is actually not insignificant. Anyway, that's 6 different strategies on ways in which you can search for a patient in the electronic health record. The key takeaway here is that the easiest and most reliable is probably to search for the patient by their number. And then there's alternative ways, if the patient is physically in front of you, to either use a biometric or a QR code or a barcode, or ideally, if they're already into a workflow, to use the patient queue to pull up the patient, or if you aren't physically seeing the patient, you might use an alternative strategy such as a patient list to direct you to their file.